So imagine your body actively building tissue where it absolutely doesn't belong, like triggering this chemical fire alarm that just never turns off.
Right. Yeah, it's an exhausting reality.
Yeah, and I mean, that is the reality for millions of women dealing with endometriosis. But, what if putting out that fire didn't require these heavy systemic medications?
Mm-hmm. Which is what we usually think of.
Exactly. What if it was just a targeted shift in your cellular chemistry, triggered by tiny needles and customized plant compounds?
It really forces us to completely reevaluate, our definition of an effective medical intervention. I mean, we are just so conditioned to think that severe chronic pain requires a pharmaceutical sledgehammer.
Right, a sledgehammer.
Yeah, so the idea of using acupuncture or herbal medicine sounds to a lot of people like bringing a water pistol to a raging inferno.
Which is exactly why today's deep dive is so vital. We're looking at a really fascinating informational document today from the Berkeley Center for Reproductive Wellness.
Yeah, it's an incredible source.
It really is. And it focuses squarely on using acupuncture and herbal medicine to treat that unrelenting pain of endometriosis. And the mission here isn't to look at alternative therapies as some vague mystical concept.
No, not at all.
We're going to look at the actual measurable cellular changes happening in the body. So, okay, let's unpack this. Before we can truly understand the mechanical solution, we really have to look closely at the biological villains, right? The things causing the problem.
Yeah, we have to start at the foundation. So the foundational issue with endometriosis, as our source outlines, is basically anatomical misplacement.
Okay.
You have tissue that is similar, I mean, not identical, but very similar to the lining of the uterus, but it is growing outside the uterus.
Right.
And most commonly, it attaches to the ovaries or the fallopian tubes or, just the tissue lining the pelvis.
And because it's similar to uterine tissue, it acts like it, right? Like it thickens, breaks down, bleeds with each menstrual cycle. But unlike normal uterine lining, which actually exits the body, this misplaced tissue has absolutely no way out.
None. And that resulting trap is what causes the devastation. Because when that tissue breaks down and bleeds within that sealed pelvic cavity, the body basically treats it as a foreign invader.
It freaks out.
It totally freaks out. The immune system launches this massive response, and it creates a state of chronic, ongoing inflammation. And the document actually identifies two specific biochemical culprits driving this.
Okay, let's hear them.
First, you get this massive flood of pro-inflammatory cytokines.
Okay, wait. Let's apply the ELI5 rule here. Explain it like I'm 5.
Okay.
Because, we hear the word cytokine thrown around a lot in medical news, especially since the pandemic.
Oh, for sure.
But what exactly is a cytokine doing in the pelvic cavity of someone with endometriosis?
So think of cytokines as like the immune system's communication network. When your body detects that trapped bleeding tissue, it releases specific cytokines. And the source explicitly names two, TNF-alpha and IL-6.
Okay, TNF-alpha and IL-6.
Right. So TNF-alpha stands for tumor necrosis factor alpha. You can kind of visualize it as the body's chemical bullhorn.
A bullhorn.
Yeah, it literally screams at your immune system, demanding that inflammatory cells rush to the area. And then IL-6, or interleukin-6, that one acts like a relentless courier. It just keeps that inflammation loop constantly active.
Wow. Okay, so the bullhorn is screaming, the couriers are running around, and the result is just massive swelling.
Exactly. Massive painful swelling.
So they're essentially turning up the volume on the pain receptors in the pelvis, making that entire region just totally hypersensitive.
Yeah, the nerves are practically bathed in this irritating inflammatory fluid. And that actually brings us to the second culprit, which is prostaglandins.
Prostaglandins, okay.
Yeah, these are hormone-like substances. And the misplaced endometrial tissue ramps up their production to just totally abnormal levels. Their primary physiological job normally is to cause smooth muscle contractions.
Wait, I want to visualize this properly. If prostaglandins cause muscle contractions, we aren't just talking about a mild ache here.
No, not at all.
We're talking about the smooth muscle of the reproductive organs actually seizing up. It's almost like having a faulty engine valve that violently misfires, causing the entire pelvic region to cramp relentlessly.
It's a perfect analogy.
Yeah.
It's an agonizing, non-productive spasm. Now, you combine the two. You've got cytokines causing severe swelling and hypersensitivity,
right?
And you have prostaglandins triggering violent muscle contractions. So this creates a vicious, self-perpetuating loop. The continuous cramping and swelling literally physically constrict the blood vessels in the pelvic area.
Oh, I see. So poor circulation, the blood flow just slows down to a trickle.
Exactly. And that poor blood flow means all those pain chemicals and kallikreins, the prostaglandins, they're trapped. They
Yeah.
just stagnate in the pelvic cavity.
Which just causes more panic.
Right. The immune system panics even further and releases even more inflammatory chemicals. It's a feedback loop.
If standard treatments are mostly hormonal therapies or like conventional pain pills, that completely explains why they so often fall short for endometriosis.
Yeah, they're not breaking the loop.
Right. Using a standard pain pill for this is kind of like taking the batteries out of a screaming smoke detector instead of actually putting out the kitchen fire.
I love that, yes.
I mean, the pain signal to the brain might be temporarily blocked, but that underlying stagnation, the cytokine swelling, the prostaglandin cramping the fire, is still raging at the cellular level.
The mechanical failure in the pelvis remains entirely unaddressed. Those inflammatory fluids are still pooling.
I want to pause here for a moment because if you are listening and you've ever been told to just deal with it, or, that pelvic pain is just a normal part of being a woman, this data is your biochemical proof that your pain has a tangible mechanical source.
Absolutely, it is physical.
Whether it's pain during your period, pain during sex, or chronic daily discomfort, it is not in your head. It is a literal chemical storm.
And validating that biological mechanism is the first crucial step toward effective treatment. Once we define the parameters of the chemical storm, we can actually introduce specific interventions to alter the weather, so to speak.
Which means we need to look at how we actually extinguish that kitchen fire. And our source claims acupuncture and herbal medicine can do this.
Yes, it does.
But, okay, I have to play the skeptic here for a second. You are talking about a biological war zone full of misfiring engine valves and chemical bullhorns.
I am.
How does inserting a tiny sterile needle into the skin or drinking some plant-based formula physically change cellular chemistry?
Well, what's fascinating here is the physical mechanism of action, because the research completely abandons that outdated notion of acupuncture as mere, energy work or placebo relaxation.
Okay, so it's not just making you feel calm.
Not at all. The document highlights two distinct, scientifically backed physiological mechanisms. The first is a direct downregulation of those specific cytokines we just discussed.
Wait, how does a needle downregulate a chemical bullhorn like TNF-alpha?
It actually comes down to neuromodulation. So when an acupuncturist inserts a needle at a specific point, it creates a microtrauma.
A microtrauma.
Yeah, and this sends a very specific signal up the peripheral nervous system, traveling through the spinal cord and directly into the brain.
Okay.
And then the brain processes this signal and responds by releasing its own cascade of neurochemicals, including endorphins. But more importantly, it sends an anti-inflammatory signal straight back down to the pelvic region.
Okay, so the nervous system is basically hacking the immune system.
Yes, exactly.
The brain is sending a direct command to unplug the TNF-alpha bullhorn and shut down those IL-6 couriers.
And clinical blood tests confirm this. This isn't theoretical.
Yeah.
Studies tracking patients receiving targeted acupuncture show a measurable physical decrease in the serum levels of these pro-inflammatory cytokines. The body's alarm system is mechanically dialed back.
That is wild. Okay, so that addresses the hypersensitivity and the swelling. But what about the faulty engine valves? What about the prostaglandins causing all that violent cramping?
Right, that requires the second mechanism, which is breaking the circulatory stagnation. So the microtrauma of the acupuncture needle also triggers a local effect called vasodilation.
Vasodilation, so widening the blood vessels.
Exactly. The blood vessels in the immediate area widen because the body naturally rushes fresh blood to the site of the needle to, heal the perceived tiny injury.
Here's where it gets really interesting. By strategically placing needles in pathways that correspond to pelvic blood flow, the practitioner is essentially opening the floodgates.
Yes.
They are using the body's own localized healing response to force fresh blood into a totally stagnant area.
And those newly widened blood vessels act like a specialized filtration system. The rush of fresh oxygenated blood literally physically flushes out the built-up inflammatory fluids.
Yeah, it just washes it away.
Yeah, it washes the pooled prostaglandins out of the pelvic cavity and into the body's broader filtration system where they can finally be eliminated.
Wow. It's acting as a mechanical solvent for a biochemical traffic jam.
That is exactly what it's doing.
And the herbal medicine, does that function the same way?
So herbal medicine works systemically to reinforce this whole process.
Oh.
While the acupuncture forces the nervous system to react in real time, the custom herbal formulas are ingested daily.
Right, so it's ongoing.
Exactly. These plants contain highly complex active pharmacological compounds. Specific herbs are utilized because their chemical properties act as natural vasodilators.
Keeping those blood vessels open between acupuncture
You
sessions.
got it. And others possess direct antispasmodic properties. They chemically bind to the smooth muscle receptors to actively prevent the prostaglandins from triggering a cramp.
So the needles initiate the flush, and the herbs keep the pipes wide open so the toxic fluid doesn't just, pool right back up again.
Yes,
It is a highly coordinated mechanical attack on the root cause of the pain.
it is. And the result is a noticeable, measurable drop in tissue irritation. The muscle contractions ease up. The hypersensitivity fades. And most importantly, this is tracked in clinical settings using standard pain scales and blood markers, not just, subjective feelings of relaxation.
I mean, I love a good physiological theory, but we need to dissect the validity of the evidence here. Is this just a fringe hypothesis backed by a couple of isolated clinics, or are we looking at a robust foundation of data?
It's extremely robust.
Because our source lays out an incredibly impressive geographic spread of research.
Yeah, the clinical data is entirely global, it's highly rigorous, and it's published in respected medical journals. The document first points to a 2023 systematic review and meta-analysis published by an international team spanning Europe and Australia.
And for context, a meta-analysis isn't just a single experiment. Researchers gather the data from dozens of separate independent studies, strip away the statistical noise, and look for an overarching truth.
Exactly. It's the big picture.
If a treatment is a fluke, a meta-analysis will absolutely expose it.
And this 2023 meta-analysis found statistically significant evidence that acupuncture led to meaningful, measurable reductions in both chronic pelvic pain and severe menstrual pain for women diagnosed with endometriosis.
Okay, so the European and Australian data is strong, but I want to push back a little on the next study mentioned in the source.
Sure.
It cites a 2023 U.S.-based multi-center randomized controlled trial published in the journal Fertility and Sterility. Now, randomized controlled trials are the gold standard for pharmaceuticals because, you give one group the real pill and the other group a sugar pill.
Right, placebo.
But how on earth do you blind an acupuncture study? You either get poked with a needle or you don't.
That is a critical question regarding trial design, actually. In high-quality acupuncture RCTs, researchers use what is called sham acupuncture for the control group.
Sham acupuncture.
Yeah. This involves using needles that either don't actually penetrate the skin or they insert real needles into random, non-therapeutic locations that have absolutely no physiological connection to the pelvic organs.
Oh, wow.
So the patient believes they are receiving treatment, which controls for the placebo effect.
That is clever. So the control group gets the ambiance and the expectation, but they don't get the actual targeted microtrauma and vasodilation.
Precisely. And in this rigorous U.S. trial, the group receiving the genuine targeted acupuncture experienced profoundly better outcomes than the sham group.
That is huge.
It is. The study proved the treatment safely reduced period pain intensity, shortened the duration of the pain episodes, and vastly improved overall quality of life metrics, things like missed work days and daily mobility.
So the U.S. trial totally validates the biological mechanism. It proves it's the specific needle placement altering the chemistry, not just the relaxing environment of the clinic.
Right.
What else does the global data show?
Well, the source brings in a 2021 Australian feasibility study that provides a crucial real-world perspective, because this study tracked women receiving acupuncture alongside their usual conventional care.
Okay, that completely shatters the myth that alternative medicine has to be some all-or-nothing rebellion against standard medicine.
It's exactly.
You can integrate this mechanical flushing process right alongside your current gynecological plan.
And integration is often the most practical path. The Australian study reported that these women saw significant drops in both menstrual pain and non-menstrual pelvic pain. Furthermore, the document highlights rigorous UK Cochrane reviews, focusing specifically on the herbal components.
Cochrane reviews are famously unforgiving. They demand the highest standard of evidence.
They do. And the Cochrane reviews noted that the pain relief provided by specific herbal approaches was often similar to, or in some cases superior to, conventional pharmacological options.
Superior, wow.
Yeah, and the defining factor was the vastly reduced side effect profile.
That cannot be overstated. I mean, if we look at standard endometriosis treatments, hormone suppressants that trigger medically induced menopause, or heavy painkillers that disrupt cognitive function and digestion, the side effects are frequently the reason a patient abandons the treatment entirely.
Oh, constantly.
Finding a modality that matches the pain relief of conventional options but doesn't create new systemic problems is a massive paradigm shift.
So if we connect this to the bigger picture, A defining metric emerges from synthesizing all these international studies. Across the board, from the US to the UK to Australia, the data indicates that many women experience a 30 to 50% reduction in pain on standard rating scales.
30 to 50%. Let's just ground that abstract percentage in reality for a second.
Yeah, let's do that.
If your endometriosis pain puts you at an 8 out of 10 on the pain scale, where an 8 means you are curled in a fetal position, unable to focus, unable to function, a 50% reduction drops you to a 4.
Right.
And a 4 is uncomfortable, but a 4 allows you to go to work. It allows you to play with your children. A 4 gives you your life back.
It fundamentally alters the trajectory of a chronic illness. And it achieves this through a physical mechanism that is generally very safe, producing only rare, very mild side effects, like maybe temporary, localized bruising from a needle.
Okay, knowing that this mechanism is backed by global meta-analyses, we need to look at how a patient actually accesses this care. How do we take these abstract international studies and apply them in a real clinical setting?
It's the practical application.
Right. And our source document actually serves as a case study for this, detailing the approach at the Berkeley Center for Reproductive Wellness.
Yes. So the Berkeley Center is located at 16 East 40th Street in New York City. And the document notes an important piece of clinical history here. It was actually the very first clinic in the United States dedicated entirely to fertility acupuncture.
First in the U.S., that kind of longevity implies they have moved far beyond just theoretical application. Who is orchestrating the treatments there?
So the center was founded by Mike Berkeley, who brings a dual expertise to the table. He's a licensed acupuncturist and a board-certified herbalist with decades of specialized practice in this exact field.
So what does this all mean for the patient walking through their doors? I mean, we established that the combination of acupuncture and herbs creates a highly coordinated mechanical attack. Does the clinic just hand every patient the same herbal tea and apply the exact same needle protocol?
No, and that is where the clinical application really elevates the science. The source emphasizes that the Berkeley Center's success relies entirely on customization.
Okay.
Endometriosis presents differently in every single patient. One woman might have a severe cytokine storm manifesting as sharp acute pain, while another might have profound circulatory stagnation manifesting as a dull, heavy, unrelenting ache.
Right, so the inflammatory fire burns uniquely for each person. The mechanical failure is different.
Therefore, the intervention must be unique. The team at the Berkeley Center evaluates the specific presentation of symptoms to create a highly personalized plan. They select specific acupuncture points to modulate the nervous system uniquely for that patient.
Makes sense.
And they formulate custom herbal blends to act as the exact biochemical solvent that specific patient needs between sessions.
It's kind of the difference between buying an off-the-rack suit and having a tailor measure every inch of your body.
That's exactly it.
The dual modality, the instant nervous system modulation of the needles, combined with the continuous biochemical support of the herbs, it creates a comprehensive net to catch the pain.
And the most vital metric of success, as highlighted in the document, is patient independence. Many patients report that over the course of their customized treatment, they notice a sharp decline in their need for conventional pain medications.
That's incredible.
They transition from merely reacting to pain flare-ups to proactively managing and reducing the underlying inflammatory cause.
Well, we started this deep dive exploring the frustrating reality of endometriosis, a condition where misplaced tissue triggers a relentless chemical fire alarm in the pelvis. But by analyzing the source material from the Berkeley Center, we've dismantled the idea that you just have to deal with it.
Or that standard medications are your only tool.
Exactly. We examine how acupuncture creates local microtraumas to physically flush trapped prostaglandins and how it modulates the nervous system to unplug those TNF-alpha and IL-6 inflammatory bullhorns. And we explored how custom herbal formulas act as vasodilators to keep the pelvic circulation open.
And we validated those mechanisms with rigorous global clinical trials, proving a potential 30 to 50% reduction in pain, offering patients a tangible path to reclaim their daily lives.
If you have been searching for a scientifically grounded mechanical solution to the biochemical traffic jam in your pelvis, this research proves that highly effective interventions exist.
Interventions that actually respect the complexity of your body's chemistry.
Right. And the document provides clear, actionable steps to explore this path. You can reach out directly to the experts at the Berkeley Center for Reproductive Wellness. Their team can be contacted by phone at 212-685-0985, or you can schedule a consultation by visiting their website at www.berkeleycenter.com. As the science shows, your pain has a mechanical source and a mechanical solution.
It really does. And, this raises an important question to think about. If a highly targeted physical intervention like acupuncture can successfully downregulate specific inflammatory cytokines to literally wash away chronic pelvic pain, what other deeply entrenched inflammatory conditions throughout the body might perfectly respond to this exact same mechanism of neurological hacking and circulatory flushing?
That is something to fiercely ponder the next time you are told an invisible fire simply cannot be put out. Thanks for joining us on this deep dive.